Well, hello everyone. We had been doing this for a while, and I was out of town for conferences, and we skipped for a while. So we are back to this coffee with KK, and we'll try to do it every Thursday around 3 o'clock, so we can answer your questions and the popular topics that we've been dealing with. We can discuss those. So we posted on Facebook and on social media that if anybody has any questions, you can ask us, and I'll try to answer that. So we got several questions actually, but I chose two today because we don't have time to answer all the questions. And we'll start with that, and then if you have more questions, obviously get on your Facebook or email us through our website, and we'll try to answer those too. So the first question is, and I don't know where these questions are from because they come through Facebook, and it could be from anywhere in the world, and we are happy to help anyone and answer any questions from anywhere. So this one is that when do I see a dermatologist about a mole I recently noticed? The first thing is we all have moles, which is normal. But if you notice a mole that you never noticed before, it must have changed. That's why you're noticing it. Either it changed the color, or the shape, the size, or it became more painful or itching. All those signs can lead to a mole that could be precancerous or cancerous. And the moles that change into cancers are called melanomas. There are other skin cancers too, but they're not as aggressive as melanoma. If a melanoma is not diagnosed early on, it can kill someone within 6 months. So it's very important. So a few features to look for are very simple: A, B, C, and D. A for asymmetry, if a mole is asymmetrical. B, borders, if the borders are irregular. C is for color. If it's more than one color, light brown, dark brown, then we worry about it. And the size, diameter, D for diameter. If the size of a mole is bigger than an eraser on a pencil head, which is 6 millimeter, then we worry about this. So any of these features, if you see in a mole, or if the mole starts itching, hurting, bleeding, if you have a family history of melanoma, you should see a dermatologist as soon as you can, and they can take a look and reassure you. There are some other growths that look like moles, but they're not moles. But most dermatologists can take a look and tell you, well, this is not a mole, so it's nothing to worry about. So I think those are the things that you look for in a mole when you need to see a dermatologist. The second question was, what causes leg veins? How can I get rid of them? This is something that we do a lot around this time because everybody wants their legs ready for the summertime so they can wear their shorts and bikinis and show their legs. What causes it? Family history can cause that. Multiple pregnancies can cause that. And your lifestyle. If you stand on your feet a lot, blood pools in your legs and can fill up those blood vessels, and you can get those. And there are two kinds. Actually three. One is varicose ones that are really big cord-like ones. Then red and purple ones, what we call telangiectasia. And then green-blue ones. Those are called reticular veins. I usually treat them with sclerotherapy or injections where we inject saline solution. Lasers are used for this too, but they're not as effective as the sclerotherapy is for most of these vessels. So I do a combination if needed, but mostly do sclerotherapy. What we inject is hypertonic saline. This is the saline that we have in our own blood, but it's a little bit more concentrated, so it has more salt in it. That's how it works. So when we inject the saline solution, you feel some burning and may feel some cramping. Then you wear pressure stockings for 1 week. All your daily activity is fine, and it takes 6 weeks to see the results. So we treat you and see you back in 6 weeks. If they're not gone, then we treat them again. Most people may need more than one treatment, but it's a very effective treatment. We have lots of photos on our website, before and after photos you can check out on skinlaseronline.com, or you can call us to schedule an appointment. I'm here. I have two nurse practitioners, Danielle and Mary. They can help. We have wonderful staff here. Some of them have been working with me for about 20 years, and we're here to help. And if you have any other questions, please feel free to let us know, and we'll be happy to help you with that. Thank you.